until I confirm my sound is clear, we shall have problems. So kindly confirm to me if my sound is clear. Seems like today we'll have a lot of hiccups. But again, we are here for this and it will happen, so don't worry about it. Just confirm that if you can hear me clearly, that will make a lot of sense to me. So we can start this. Are you guys able to hear me? Today we are going to have a lot of issues. Seems like today we're going to have a lot of issues with the sound. Kindly, if you can hear me clearly, let me know before we begin. Hello, ladies and gentlemen. I'm still waiting for the signal to confirm our sound so that we can start. Good. Today's live is about asthma, one of the chronic conditions that most of you did not know or you never realized. That is an inflammatory condition. And I'm going to tackle it very clearly so that most of you get to understand it. And once you understand it, you can know if you can reverse it and lead a healthy life. I want you to understand that asthma is actually reversible. So don't fall for the lie from the big pharma that asthma, there's some background noise. What is happening here? Happening today? Just confirm the voice before the sound before I start this one. There's a lot of background noise. Somebody's saying that. Is it clearer? Somebody said sound is okay now. I don't know what happened. It's clear now. Okay. Let's give ourselves like a minute to see if it's stabilized. If it's not stabilized, then we can end it and start afresh. It's clear now, right? Relying on you to tell me if it's clear. Is it? Good. Everybody's saying it's clear. So yeah, we can begin now. So welcome again to yet another live. This is Dr. Lewis from Health and Wellness Sports. And thank you for being patient with us. Thank you for logging in. And thank you for giving us the updates. Again, I'll repeat, today is the day that I'm going to talk about one of the chronic conditions and also an inflammatory condition, which is basically an autoimmune. And most of you did not know it is because of how the big pharma is designed to sell you fear, and then after that, to get you hooked to their products, the asthma drugs. Just the same way diabetes comes in handy, is the same way asthma comes in handy. So it's high time that we unlearn most of the things that are about this topic. And so, welcome aboard. Now, let me start by just defining by the use or by uh, the syllabus, the definition of the syllabus. This is how it goes, that asthma is a common, and I want you to take to actually take note of some words that I'll be underlining as we proceed. So, number one is asthma is a chronic disorder. Underline the word chronic disorder of the airways that is complex. Underline the word complex. The reason why I'm saying underline the word complex is because that's already selling you the fear that it basically it's a disease that we don't understand. So then, if we don't understand it, how are we treating it? So asthma is a common chronic disorder of the airways that is complex and characterized by variable and recurring symptoms: airflow obstruction, bronchial hyperresponsiveness, underline the word hyperresponsiveness, and an underlying inflammation, underline the word inflammation. This is why we'll start questioning these definitions, because some of these definitions are just there to actually bombard your head and get you into confusion, so that once you're afraid, you get that fear, and somebody's telling you asthma is irreversible and it's chronic, it's complex, it's a hyper responsiveness. All these words are just there to just make sure that you are scared, and that if at all you wanted to reverse it, you will only have one channel to reverse asthma, and that is medicines or drugs. That is not right. So I want you to know this. On the complex, that is a lie. It is an easy disease to just define. Basically, you have your bronchioles narrowing, and therefore there's nothing complex about that, apart from the immune complexes that come as a result of an overstimulation of the immune system. Number two, bronchial hyperresponsiveness. Now, the word hyperresponsiveness, what it's actually saying is you have an inflammation that is actually going to confuse your immune system and make your immune system think that this is a foreign thing in the system, so it starts to fight it. That's how autoimmune happens. So you have an army in the name of white blood cells that is actually going to sense that this gentleman is having problems breathing, but this breathing is being brought about by inflammation. And now this inflammation is actually the reason why your immune system starts to think this is a foreign activity, and it has to fight it clearly. Okay. So now, and number three, since it is hyperresponsiveness, and we've mentioned the word inflammation, in the system, you have glands that are called the adrenal glands. They are on top of your kidneys. Those two glands, very sensitive glands, they produce progesterone as women age. So when your ovaries stop producing progesterone, and now the adrenals take over. But the most important part, they also produce a hormone that is called aldosterone, a hormone that we talked about earlier in our previous lives, that actually controls your blood pressure. So if you have failing adrenals, then definitely your blood pressure will be uncontrollable. And then those glands produce majorly the corticosteroids, a hormone that is called cortisol. If you've been here for long, you understand cortisol is a hormone that actually helps you fight stress. So it's a stress hormone. The body produces this when there is high inflammation, when there is a lot of stress in the system, and this hormone is supposed to help you clean out that inflammation and help you recover from this chronic inflammation that is happening in the system. So this is one of the reasons why when you have asthma, that inhaler that you use has a drug that is called budesonide or beclomethasone. And that's why you also get an injection of hydrocortisone. These are basically external steroids. They are called corticosteroids. They're drugs that are synthesized from steroidal hormones, and specifically the cortisol. So this cortisol naturally is coming from your system. So your system produces cortisol naturally to help you fight stress and inflammation. Now, there comes a time when your immunity or your white blood cells or your army against diseases is overreacting. Okay, we will talk about what is causing that overreaction. But when this army is overreacting, it starts to target your own cells. So it doesn't even know how to differentiate your cells and their foreign cells. So it starts targeting your system. So if it targets the gastrointestinal tract, the digestive tract, that is what you get. That's how you get IBS, the inflammatory bowel syndrome. If it targets your bronchioles, that's where you get bronchial asthma or obstructive asthma. So that is basically the path of pathogenesis of asthma. So how does asthma come to happen? First things first, you have an immune reaction, and then you have this chronic inflammation in your lung, in your bronchioles, that is actually causing production of mucus, and that mucus is actually narrowing your bronchioles, so you struggle to pass air. Also, inflammation causes swelling, and therefore, when the walls of the bronchioles swell, they start to narrow. That's why you produce those wheezing sounds when you're trying to breathe. So that is the point here. The point is one, autoimmune, so overreaction of the immune system. And remember, the cortisol that we are producing from the adrenal glands is actually coming in to remind this overreacting immunity that this is not a foreign agent. So don't fight it. So cortisol comes in to actually help you to change the immune's mindset so that the immune does not target your bronchioles. And that's the reason why you use that corticosteroid in that inhaler. For those of you who have had chronic asthma, they know the use of a corticosteroid. Okay, and those are the likes of the drugs that end with ONE apart from budesonide. So if you read your inhaler, you'll see those drugs. We have one that is a bronchodilator, there's salbutamol or terbutaline, and then we have others that are steroids. Okay, and some of you are even using prednisolone. But I want you to know that these drugs that are used for asthma, the corticosteroids, can actually raise your blood sugars. So for people who have diabetes, this becomes a problem when you're trying to use drugs for asthma. And that's where we really are now, because now we need to reverse that without having to use those drugs, which basically means you have a lot to do when you're diabetic and you have asthma at the same time. So it becomes a serious problem. So now, from that definition and from those drugs, we can easily know how to go back and reverse asthma. Number one, we need to lower the overreacting immunity. And how do we lower that? We need to instruct our adrenal glands to produce more cortisol so that it can suppress the overreacting immunity. So most of us have messed up our systems, have messed up our adrenal glands, and these adrenal glands are actually sluggish. So they will produce very minimal amount of the hormones that are supposed to help you fight inflammation and also remind the immune system that this one is our own cells or this one is our own tissue, so do not target it. Okay, so that's where we fail, because the foods that we eat are actually highly inflammatory, and that's the problem, because if these foods are highly inflammatory, they are going to inflame the system in general. They are going to kill the adrenals or make it very, very docile, and that will actually impair the immune system or the body's ability to fight inflammation. Therefore, inflammation will be there. So when they try to tell you that this is a chronic condition that is complex and cannot be understood, just listen to this, that asthma is a common chronic disorder of the airways that is complex. So they already sold you the fear. So even your doctor, this is what they studied. This is what came when they were studying asthma and when they're studying pharmacology. So you can imagine that already your doctor has believed that asthma is irreversible. So therefore, he just passes that to you. He just passes that to you without understanding the basics of it, because he knows once the bronchioles are narrowing, you cannot reverse it. You can only use drugs to dilate the bronchioles. Now listen to this. Salbutamol, or the one that you call, most of you call it, how do we call it? This salbutamol is very common, and I don't know how you people call it, brand names that are very common. So what happens is, this salbutamol actually causes a relaxation in smooth muscles that form the wall of the bronchioles. So therefore, that makes it easy for them to dilate. Now, that dilation is treating the symptom, because the symptom of asthma is narrowing of the bronchioles. So when you dilate them, you're just treating the symptom, but you've not treated what actually caused the narrowing of the bronchioles. This is where they don't understand it. This is where they'll tell you it's irreversible, because of course, if the syllabus says it is irreversible, then so be it. Like we cannot treat it, we can only manage it. But the reality is you have bronchioles overreacting and hypersensitivity or hyperresponsiveness, which is basically being caused by inflammation that is caused in the system. Now, I will actually talk about asthma from childhood all the way because most of you are diagnosed of asthma in childhood, and then this proceeds, and you're told you'll be on these drugs for a lifetime because, again, it is irreversible. So in this channel, we actually try to question this. We understand the disease by definition, we understand the causes, and then when you're trying to manage, we understand how drugs work because we have information about mode of action of drugs, how drugs work. Now, when you understand how drugs work, you can use that mode of action to actually reverse the cause or actually get to the cause. And then now, once you clear the cause, the symptoms disappear. So if you keep on treating the symptoms of asthma, you are focusing on the wrong thing. This is the same thing that is happening with most chronic conditions, be it arthritis, be it diabetes, be it hypertension. All medical interventions, including surgery, are targeting only the symptom and not the cause. So for you to understand asthma, basically, bronchial hypersensitivity or hyperresponsiveness, where is that coming from? It is coming from failing adrenal glands because these adrenal glands are the ones which produce hormones that are supposed to suppress your hyperresponsive or hyperresponding immune system. So inflammation happens in the lungs, you start getting production of mucus, that mucus blocks your airways, you start getting swelling and the bronchioles start swelling and narrowing. Once they narrow, you start wheezing, start having difficulty in breathing. You cannot pass air in and even out. So you might end up into respiratory acidosis. Okay, so this is a problem that we talked about that when we were talking about diabetes. So when you have that hyperresponsiveness, then you have bronchioles constricting, and now you have mucus production again, which is blocking the constricting bronchioles. Now air cannot go through. Once air cannot go through, that becomes a serious problem to you, and that is what we call asthma. So for you to make it easier for yourself, just know there is a reaction that is causing inflammation, and systemic inflammation is coming from what we have been eating. And then when you get this inflammation, your immune system starts to react and overreact because it's thinking this is a new agent. Now, once it overreacts, that is translated into the bronchioles narrowing and you getting asthma. The only thing to do is to reverse this hyperresponsiveness by activating the adrenal glands. And how do you activate the adrenal glands? How many times in this channel have we mentioned about inflammatory foods? Inflammation does not come from the air. So this disease is not complex. Inflammation is coming from what we've been eating. The seed oils, the wheat products, the sugar in all forms, including fruits and honey, the restaurant and processed foods, the sodas, the energy drinks, those milk formulas that you give your children, some of the deodorants that we use, some of the soaps which are bacterial, basically the antiseptic soaps or the bacterial soaps that we use, the medicated soaps that have antibacterial agents like triclosan. These are things that are actually causing you all these problems. But for how long shall we keep mentioning about chronic inflammation and the foods that cause inflammation and nobody listens? I have come to realize that most people don't want to be saved. And the worst part of it is that most of you, free information is highly toxic. When you get access to free information, it is highly toxic. Therefore, you need to pay for this information so that you start listening. Because when somebody sees the amount of money that they have pumped into this condition, it is easier for them to listen. Just look at how many people who come onto my lives, who are on my Telegram channel, who have subscribed on my YouTube channel, who follow me on Facebook and Instagram. But the same people have read all this information, and if you ask them, what is your cooking oil? They will still tell you, ile ya kawaida. And when they say ile ya kawaida, what they are meaning or what they are saying is seed oils. So how many of you are still using seed oils in their kitchen? How many women are now going for CS deliveries? Not because they have qualified for CS, but because they don't want to give birth naturally because they have been told or convinced it is painful. How many of you women don't want to breastfeed your children for 6 months exclusively because you're thinking your breasts will sag? Now, let me just be honest with you. Those breasts were designed for that baby. Those breasts were not designed for suckling by your man. They were not. Yes, Catherine Mdoni, salbutamol, which is Ventolin. Yes, Ventolin, the inhaler, and Ventolin, the tablets. They're usually pink in color. Those are the drugs that actually treat the symptoms of asthma. They don't treat asthma. So how many of you ladies have decided that now we need to make the men happy by maintaining a certain form of breast shape without breastfeeding? So you don't want to breastfeed because you want people to be impressed that you're a mother, but you still have breasts that are upright. How many of you, even when you're pregnant, you're eating so bad foods, you're still using seed oils, you're still an addict of sugar, you're still consuming those fruits, you're still eating every crap and then defending it by saying cravings that come with pregnancy? How many of you are doing that with the hope that they'll still produce breast milk, which is enough for their babies? Now, if you eat crappy diets during pregnancy, your child will lack the essential micronutrients. They will lack breast milk. So you come to think about it this way. One, you've given birth to a child through CS. That child started again at 1 meal down because no immunity at all, because the immune system jumpstarts itself when the child gets to interact with bacteria that are in the vagina of the mother. So when you have that sterile CS, very sterile, no bacteria, no nothing. So this child comes out to the new environment with a low immunity. And then now, since you are obese, since you eat very unhealthy foods, you don't like breastfeeding, it's not frequent, the next thing that you're going to do is you're going to put this child on milk formulas, the nuns. For all this time, your child is on milk formulas. And then now, slow by slow, you start introducing noodles, you start introducing wheat products, bread, soda, sweets, biscuits. All these are bad combinations of sugar and wheat. Spaghetti is there also. Chapati is there, mandazi is there. So now most of even women come to hospital with a child, they give them pasteurized milk, they give them sugar, they give them soda, they give them juices with the hope that these juices are natural and they have energy, the leukocytes, the ribenas, they'll boost your child's energy and stuff. So this child is born through CS. This child is introduced to milk formulas and soy products. And the mother also is told, if you want to produce breast milk, when you give birth, the first thing you do is to take drinking chocolate or the cocoa so that you produce breast milk. What a mess in the health system. So now, CS birth, milk formulas. You start weaning the child on very bad foods. Now you are a very cautious mother because you still don't want your breast to sag. So you are actually being more cautious by just sanitizing every surface your child plays on. And then guess what? The big pharma has brought you that product that is 99.9% effective against germs. You know it. They even showed a video of a mother and a child that every surface this child touches, the mother sanitizes that surface. You know that product. That product has triclosan, which is actually an allergic stimulator. It's actually going to bring your child asthma. So now, this child, every surface they touch is sanitized. So zero immunity, because they don't come in contact with bacteria or viruses or fungi that are actually supposed to help them stimulate the immunity, because the immunity works this way. Once you get one exposure to a microorganism, it gets to produce antibodies against it, the immune cells against it, but then keeps that memory so that the second exposure to that microorganism, your immune system finds it easy to fight it. So it becomes even stronger when you expose it to more microorganisms. So your child does not play in dirt because you live in the urban setup and your child is always enclosed. Your child does not go out, is always a zombie playing PlayStation, watching movies that are indoctrinating your child. This child does not play with pets When we were growing up, I remember we used to go hunting with dogs. Dogs were our favorite friends, so we used to interact with dogs. We used to sleep around dogs, and the far from the dogs never caused us asthma for a reason, because a child needs to interact with these pets. Stop sanitizing all surfaces that this child plays on. Women, stop going for CS for fun. CS is an emergency fix. It is not for fun. So stop going for emergency fixes as fun, so that you take a video and post to us that you paid for the most expensive CS to give birth. You're messing your system up. That's why you qualify for a CS. You don't just walk in and tell your doctor you want a CS. If a doctor does that, that's a rogue doctor. He just wants your money and allowances. You qualify for CS. There's a procedure under which a woman qualifies for cesarean section. But nowadays, every woman is going for a CS because of the fear of giving birth, because of the lifestyle. So you're overweight, you don't even walk when you're pregnant. Therefore, your cervix is difficult to dilate. The health of your baby in the uterus is actually messed up because of what you've been eating. So low amniotic fluids. So there's so much risk. The food that you're eating, the life that you're leading, a lot of stress in your life. So all these are actually qualifying you for a CS. But most of you don't have these issues. Most of you don't have even cravings. Most of you just eat foods because of your lack or addiction to food. You are addicted to food and sugars. Why don't you crave for eggs? Why is it that pregnant women never crave for protein? Most of them crave for sugar and carbohydrates. So now this child has a compromised immunity already. The adrenals are not as active as it will have as the body wants it to be. So a slight change in the system, a slight inflammation, will cause problems. So this child is on milk formulas from the third month or even the second month. This child has been consuming plumpy nuts all through. But most of you never read the ingredients of these products. So then when your child gets asthma, you start wondering, where did it come from? And our family, we don't have asthma in our family. Of course, asthma, a very small percentage of asthma is genetics. Very minimal percentage, possibly a 5 at maximum, that carries the genes for asthma. But the entire population that has asthma is because of bad feeding, bad diets, CS baths, milk formulas when they were young, and all this sanitization of every surface they play. Let children play outside. Let these children get interaction with pets. Let these children play with dust and mud. Feed your children when they come back to ask for food. Don't overfeed your children. Don't load your children with cough syrups, with antibiotics every weekend. It is so annoying when a mother is always in hospital picking antibiotics after antibiotics because the child cannot survive without antibiotics. So imagine that. Imagine a CS birth, zero immunity. Then you move to milk formulas, zero immunity. And then you move to unhealthy foods and sugar and sweets and biscuits, zero immunity. And the sodas. And then no pets, no dust, no mud, zero immunity. And then now 5 meals a day for this child. Every time this child turns, there's a meal, there's a sweet, there's a juice, there's biscuits, there's sausages, there's margarine. So the entire system of this child starts getting inflammation from an early age. So how do you expect the immunity of this child not to overreact? It will overreact. And apparently when it overreacts in the bronchioles, that's a problem. This child, at the age of 9, they're already having gastritis. And guess what? You give them omeprazole or an antacid. So by the time they're getting to 18, this child has suffered all chronic conditions, inflammatory bowel syndrome, gastritis, asthma, they are fat, lack of sleep. So it's not by coincidence that the syllabus defined asthma in that direction. They understood the assignment. They knew that most of you will get an addiction to food products. Most of you like sedentary lifestyle. Most of you don't even, 85% of your time, you're in-house, you're not outdoors. Then you call yourself, I'm an introvert. It's not fun. You're not an introvert. Possibly you don't have money. Because if you had money, you'll be an extrovert. I don't like the sun. I just like indoors. Listen, these are natural remedies for your life. You need the sun. It's not about liking the sun. You need it because of vitamin D that boosts your immunity. Because again, those people who have deficiency of vitamin D end up getting asthma. Babies who have a deficiency of vitamin D, those who have rickets, chances of them having asthmas are high. And then now a baby is getting all cough syrups. Anytime they cough is a cough syrup. Anytime they cough is an antibiotic. Yet these children are eating so much sugar. So why don't we just change the diet of this child so they don't end up giving this child all these things? So those drugs that you're using to treat asthma, treat asthma, those drugs are actually going to treat the symptoms of asthma. They're just going to manage asthma. They don't treat, they manage asthma and they treat the symptoms of asthma. Ventolin is a bronchodilator, opens up the bronchioles that are closed, but it doesn't treat what caused the constriction of the bronchioles. That corticosteroid, that inhaler that you're using for prolonged or chronic asthma, is a synthetic steroid. So it's actually going to suppress your adrenals even more. Why don't you just drop the foods that are actually killing the adrenals so that you get your adrenals functioning well, and now they start producing cortisol, which will help you reduce the inflammation and you recover from asthma. Is that so hard to do? Is it so hard to do? Of course, the answer is no, it's not. It's not. It's only that all of us want the shortcuts to these things. And the shortcuts are easy, but they come with a lot of consequences. A lot of consequences. So why don't you take care of those children? Because asthma is diagnosed in childhood. Asthma does not start when you're an adult. It's diagnosed in childhood, and then you're told now you'll take these drugs for a lifetime. So if you want to be safe or sane from asthma, then now you know what to do. Simply drop the inflammatory foods that are actually causing you inflammation. Drop those foods, the wheat products, the seed oils, the sugars. Stop feeding your children fruits apart from avocado. Fruits are not healthy to your child's gut or immune system in general. They are not. Stop giving your children or your baby milk formulas, the plumbinats, because they are malnutrition. Just feed your baby with healthy foods. And these are the healthy foods for the baby. The liver, a superfood. The egg and yolks, superfoods. And most of you will tell me, no, if I give my baby eggs, they will get the skin allergy and the pimples. That is not true. Eggs will only expose a rotten gut. So actually, asthma is going to be healed or reversed by healing the gut. And we've talked about how to heal the gut. So asthma is about the gut problem. It's about the adrenal problem and sluggishness. So fix the gut, fix the adrenals. Drop inflammatory foods, the obvious ones. Let your child play outside. Drop those drugs, those cough syrups and those antibiotics that you take every time, unless they are prescribed. Don't use antibiotics and cough syrups. Actually, cough syrups make it worse. Do you know in asthma, when you give this child a cough syrup, it gets even worse. And by the time they're being given an inhaler, it has gotten so bad. So if you have asthma already, we are not saying that you don't carry your inhaler. Please carry your inhaler so that you can help people to help you. So if you get an attack someplace, and then somebody can easily get into your bag and get that inhaler and assist you to recover. But as you do that, start fixing the gut. Start fixing inflammation in your system by dropping those inflammatory foods. Don't go to the gym and take protein powders. Those are still inflammatory foods. Drop the stress levels in your life because stress can actually exacerbate asthma. There is another group of drugs that is called the NSAIDs. I keep talking about NSAIDs because most of us are just guilty of buying over-the-counter painkillers, the diclofenac, the ibuprofens, the meloxicam, the aceclofenac. Did you know what these drugs do? These drugs, one side they block pain, but on the other side they open production of leukotrienes, the aspirins. So those of you who keep on taking that paracetamol tablet that has aspirin, Be very cautious. And asthma patients should never take these NSAIDs because it blocks the pain, yes, but on the other side, it's actually killing your kidneys, it's actually killing your adrenals, and these drugs are actually causing production of leukotrienes. Now, if you know leukotrienes, leukotrienes are the asthma mediators. So imagine one side you're blocking the pain because maybe you have a back pain because of your weight, maybe you have an injury because of your weight, maybe you have just a physical injury, or maybe you have just physical trauma. So on this side, they are blocking the pain. Yes, very good. How about the other side? They are actually opening up the channel that will produce leukotrienes in plenty. So the leukotriene side starts being activated. Then when you activate that side, what are you getting? Asthma attacks. So why do you think you did these painkillers though? Why do you still walk into a pharmacy and buy ibuprofen and buy meloxicam? And if you're asthmatic, please tell your doctor that I have asthma so that when they are prescribing drugs, it's easy for them to know the drugs or the painkillers to prescribe for you. Don't buy a drug and then ends up closing up your bronchioles. Now you start dying for no good reason. Don't die when you're here, you can change your life. So somebody telling you that asthma is irreversible, that person is a criminal. He's an agent of the big pharma. He's a syllabus medic. And he's just actually regurgitating the syllabus. What he has been told is actually what he is regurgitating. He's not talking to you about diets because he even thinks that asthma is not related to diets. Why are you even listening to him? That's why we exist here, to actually open your head or your mind to most of the things that we go through. And by the way, most of us have had maybe a relative or a friend who has had asthma. Do you know how they struggle with these things? When they can easily drop that chapati maharagwe and they start eating the liver, the eggs, the avocados, fish which has high content of omega-3 that is actually an anti-inflammatory, so cures your inflammation. But don't buy the fish that has been deep fried in seed oils. Just buy fresh fish and go cook at home. Use ghee to cook. Use essential fats, the ghee, the tallow, the butter, the cheese, the coconut oil. Use those as your cooking oils or fats. Don't walk into a restaurant to eat any food in from the restaurant. That food is not cooked by ghee because ghee, restaurants cannot manage cooking foods with ghee. They want customers. Restaurants cannot afford to avoid using sugar because they want to as addicted to their foods as possible so that you go back. The same thing is happening with the food industries. They add fructose and sugar in your products without adding that on the label. And guess what is happening? That sugar is intentionally there to help you get addicted to that product. Once you get that addiction, you're a customer for lifetime. And then now they sit on syllabus, on nutrition syllabus boards, they sit on pharmacy syllabus boards and medicine syllabus boards. They create this syllabus and then they bring that research that you people keep on asking for. Where is your research? Where are your papers? That research is actually, no good research sees the light of day. So they bring it out. Now you read it and you become so conditioned. Now you're just thinking asthma cannot be reversed. I need to take my salbutamol. And by the way, did you know that salbutamol is not supposed to be taken every day? It's an emergency drug. It's a pill that you pop only when there is an attack. Because there is something called desensitization of receptors. So the more you take that tablet, the more your receptors become desensitized to that tablet. That drug is useless. As you take it, the more you take it, the more useless it becomes. Therefore, the next time you get an attack, you use that inhaler, nothing happens. You have to be hospitalized. This is what they call status asthmaticus. Again, another syllabus term. So if your doctor has never mentioned to you about dietary modification that will help you fix the gut and is actually managing your asthma, simply know that you are a customer and you're not a client to them. You're a customer. So zero stress, zero inflammatory foods, the seed oils, the wheat products, the sugars, zero restaurants food and processed foods, reduce your travels to the supermarket. unless you're going for toiletries or you're going for ghee or coconut oil. Enjoy the sun. If you're an adult, start fasting. Fasting is very healthy for rejuvenation of the system, both the inflammation that is happening in your bronchioles and in your gut. And we talked about inflammation. Actually, we'll talk about the series of conditions that come as a result of inflammation: arthritis, gout, asthma, inflammatory bowel syndrome, gastritis, including peptic ulcer disease, and your favorite H. pylori. Use antibiotics only when it's necessary and when it is prescribed. Use them for the shortest period of time. And after an antibiotic dose, go for the fermented cabbage to replenish the bacteria in your gut that are helpful for you, that are healthy for your system. Hemorrhoid is another, Alex, hemorrhoid is another inflammatory condition again of the gut. So these are things that you can do on your own. These are not things that you really actually need us to help you, to assist you to go through it. There are things that you can do. Enjoy salt so that you can fix your gut, because salt is very good at fixing the gut. And that's for babies. If your child, if you just have a child, if you want to raise very healthy babies, start when you are about to conceive. Don't ever think that you'll start raising healthy babies after giving birth. That is a lie. Because you lack breast milk, and that will force you to go for milk formulas, which are actually inflammatory to they cause inflammation to the gut of the baby. They cause inflammation in the system. They cause allergies because they perforate the gut, and therefore any protein that gets into the gut finds access to the immune system. And now immune system has to fight it. And remember, if a child is born to CS, the immune system is even lower. So if these milk formulas mess up their guts, the inflammation is going to go higher. And this is where autoimmune conditions come in. So you're wondering why this child has autoimmune all the time. And your doctor tells you the child has autoimmune, but doesn't explain to you where this autoimmune is coming from. Now they put you on steroids to suppress the autoimmune, but they don't tell you where this autoimmune is coming from. You're just suppressing the symptoms. How about the cause? If you start talking about the cause, we will treat a lot of conditions. And please, take me serious anytime I talk about diets. You are what you eat. Take me very serious anytime I talk about dietary modifications, because I know and I understand that your system will only work super efficiently when you supplement it with appropriate diets. Let your babies eat fish. Let your babies eat the liver, the eggs, avocados. I'm repeating this because there are people who have not gotten it. Drop those seed oils and vegetable oils. Let your baby use ghee, tallow, butter, coconut oil. If you're an adult, start fasting, whether intermittent or prolonged fasting. If you have asthma, fast. Drop those antibacterial soaps. Drop them. Let the child play with pets. Let the child play with dust. Don't sanitize every surface this child plays on. And for you, most of you who are using those non-sticky pans, you're actually going to mess your child's gut. Also your gut. Enjoy salt in plenty. Salt has never been the problem. Salt fixes your problems. Sugar is the problem. No milk. No pasteurized milk. No any other milk. Unless it's breast milk for your baby. Remember, there's a reason why babies win off their teeth from, they win the milk teeth. Why is it that those milk teeth disappear and then you get other teeth? Because it's now time for you to eat healthy diets, not milk anymore. Milk is for calves and babies, but let that be breast milk. Don't human beings are the only ones that change the species. If milk was that important, we would still be suckling our mothers up to now. How is it possible that we change the species and now start suckling the cow? And then we become very specific. We don't want to suckle the donkey. How is that making sense? Then supplement, what we call targeted supplementation. Most people who have asthma are low in vitamin D. So eat those fatty meats. Enjoy those green leafy vegetables. Go out and take a bask on the sun. It's very healthy for somebody who has vitamin D deficiency. Most of you have selenium deficiency. So go and eat those nuts. Brazilian nuts, cashew nuts, ground nuts, roasted. Don't buy them in the supermarket. Go make your own ground nuts. They have high content of selenium. Eat those pumpkin seeds for zinc. Eat those avocados for magnesium. You need these supplements. That is what we call targeted supplementation. If you can't find these foods, then now you can go for supplements that are rich in magnesium, but make it a single agent supplement. So for if it's magnesium, let it just be magnesium. If it's magnesium picolate, so be it. But don't go for a multi-supplement like the vitamin B complex, like the magnesium plus zinc plus whatever. That is a lie. And only use supplements as targeted. So targeted supplementation. You're actually realizing I have asthma and I have low magnesium, go for magnesium supplements. And magnesium supplements are actually in the sea salt. So most of these nutrients are in the sea salt. So you don't even need the supplementation from those supplements that are being sold by that company. There is no supplement that is not in food. So good. I think it's time for me to answer some questions here and there. Let me see who has a question here. And thank you so much, guys, for logging in. Even though we had the hiccups in the beginning of this video, we actually knew it will be very, very educative. So thank you so much for being patient with us and logging in. If there is a question for me, kindly post it on my comment section so that I can address it as we target to clear this. Wasike said, some say they prefer CS so that they can remain tight. Now, just listen to that statement that women prefer cesarean section so that they can remain tight. And then the question comes in, for who? For who? Because your husband is the one that made you pregnant. He was actually expecting you to give birth. And your vagina is, how loose is that vagina though? We all know about flexibility of the vaginal wall, stretches and contracts. So if your husband is actually targeting the tightness of the vagina, you married the wrong one. Because children will come through that vagina and you'll still have to feed on it anyway. Feed in quotes. So if CS is supposed to make your vagina tight, that means actually you are targeting the wrong things. You're actually doing the wrong thing because nature wanted you to deliver naturally. CS is not a natural way of giving birth, but it's a good way of giving your doctor money. It's a good way if you are a content creator, you want to just take videos and post to us and tell us how you're doing good in life. Safi, healthy eating is the best way to go. Listen to me, Safi. There is nothing that beats diet. Nothing beats diets. You can see pregnant women eating bad foods all the time and they blame it on the pregnancy. Believe me, pregnancy only exposes your bad eating habits and your addiction to sugar. So progesterone just comes in to actually show you that you've been doing the wrong things all through. So we hide in the name of diets, we hide in the name of cravings. Pregnancy comes with cravings. No, you're just a food addict. Diets beat everything. Abdulaziz Nangabo, if you are not ready for motherhood, don't go for it. Our mothers never opted for CS. Perfect. And again, none of our great grandfathers or even our fathers complained about our mothers' vaginas being loose. They never quit those marriages because their mothers gave birth naturally. If the tightness of the vagina was the one that was responsible for holding a family together, and then we would, all of us would have been from single parenthood families. But they focus on what is important because everybody, there's a bundle that comes in, a bundle of joy that comes in that child being born naturally. So some consider CS not as, we can't, I don't know, people think CS is not a way of giving birth. So if you had a CS, you did not give birth. But the reality is, yes, you gave birth, but not in a natural way. Healthy eating is not bought in the supermarket. Nowadays, most of us don't have time to prepare those meals, doc. Now everybody has time. All of us have 24 hours in a day. If you're doing 1 meal a day, if you're doing 2 meals a day, how can you even lack time for that? Most of you people don't have just time. As in, you're so preoccupied with a lot of things. Nowadays, TikTok is all over. And if you go on a live that is talking about sexuality, is talking about reproductive health in a way that is a quick fix, talking about quick fix of losing weight and stuff, you will find a lot of people watching those type of content that are appreciating it. They will even pay a lot of money to go and have a bariatric surgery, to go and have a CS, but not focus on what is important. Just eating healthy foods, having light exercise so that your pelvic becomes a little flexible, so that by the time you're giving birth, your cervix can dilate easily. Most of you even complain, if I go, if please keep your complaints to yourself and start fixing what you have to fix. If you are asthmatic, you already know that you cannot even afford a complaint, because one mistake, about 4 minutes, you're out. The 4 crucial minutes can take you out easily. If you're lucky, that is. If you're not lucky, 2 minutes are enough to take you out. Does matumbo have nutritional value? Professor, yes, it does. It's an organ meat. Remember that. So people who have these conditions are supposed to also eat traps. What are the effects of deodorants, antiperspirants, and are there alternatives to them? Yes, we have alternatives to them, and alternatives are in diets. If you have a bad scent, it's because you're eating crap. So no deodorant, no amount of that perspirant or that deodorant will fix your problem apart from fixing what you're eating. You already know you can use that deodorant and that perfume, and then in the evening when you come back home, you're smelling like a goat. Yet you use a perfume in the morning. Those things have high content of estrogen. Estrogen is also highly inflammatory to your adrenals. Those things have phthalates that will actually mess your system in general, and those things have Teflon. And also parabens, the methyl parabens. Those are things that are used as preservatives, but they are so detrimental to your health of the skin and of your adrenal glands. Stay away from them. On your skin, you can actually use coconut oil. It's very effective for your skin. But sometimes CS is unavoidable. This is Awevia any. That is true. That's why I said CS, you qualify for CS. You don't just go for CS, you qualify for CS. There is a procedure that is supposed to be followed for you to qualify for a cesarean section. You don't just go in and tell the doctor, I want to do CS, because again, you alter your psychology. Once your psychology is messed up, that is one of the P's, the 5 P's during delivery. So when your psychology is out, of course, you'll not be able to even push an inch. OTGMO, kama kawa, I'm here for a medical degree. Good evening, Doc. Good evening to you. Welcome aboard. It's so sad how plumpy nuts are supplied in plenty in Kenya, especially poor regions in this country. You can count me on that. I'm literally in places where plumpy nut is the best food ever for babies. I gave my baby plumpy nut and they grew this fat, because they consider fat kids as healthy kids. A kid with a double neck, this kid is busy suckling ice cream, and the mother is bringing them to hospital every week with a cough that doesn't go away. And now they end up chopping off the tonsils of this child. But they chop off those tonsils, but this child still gets a very severe cough, and it's always this cough syrup after the other. And the big pharma is very bright. They actually combine those cough syrups with sugar and honey. Then they tell you, honey soothes the throat. Honey was used traditionally for cough. But people who have asthma know cough syrups will make it even worse. That's why they run for the inhaler so fast. They don't run for a cough syrup, even if that cough syrup has salbutamol. So cough syrups are not solutions. Antibiotics are not solutions. So if you did not learn anything from this is a summary, a good summary for this video. Number one, asthma is not complex. Asthma is a bronchial hyperresponsiveness. Your bronchioles are just hyperresponding. And why are they doing that? Because there is high inflammation in the system. That is one. Number two, because your adrenal glands are actually sluggish and they are failing. So where there is high inflammation in the system, your immune system overreacts and thinks, hey, I need to clear this thing here from, that's my job. So it targets your bronchioles, start attacking the bronchioles. That's where you get the autoimmune. So asthma is an autoimmune condition. And that autoimmune is suppressed by active adrenal glands. But since you've been eating so unhealthy foods, you killed your adrenal glands. They became so sluggish, so they cannot produce cortisol to suppress the overreacting immunity and to remind it that, hey, this is our own cells, so don't target it. So you're eating bad foods that are killing your adrenal glands, and then these foods are causing inflammation, and now your immunity starts to overreact. And now, because you don't have something to signal your immunity, don't overreact because the adrenal are dying, asthma comes in. If you're a smoker, of course, you know smoke is involved in literally everything, including COPD, the chronic obstructive pulmonary disease, which is part of the obstructive asthma, the emphysema. Now you rush to hospital and you get that prescription that has a bronchodilator, which is Ventolin. This bronchodilator is actually treating the symptoms of asthma and not the cause. The cause is inflammation. The cause is in failing adrenals. Fix the inflammation, fix the adrenals. Now you go for steroid drugs like hydrocortisone, like dexamethasone, like budesonide in that inhaler. But the reality is these are synthetic steroids. So these are steroids that are made in the lab and in these big pharma companies. So why would you go for synthetic things when you can get natural things from your adrenal glands? Simply activate your adrenal glands, because once you bring in these synthetic agents, you're actually telling your immune system, your adrenals, not to keep on dying, because now you can supplement it from external. Just the same way you use drugs for diabetes, you kill the pancreas, and then now they bring you insulin therapy. Yet the pancreas can easily control blood sugars. So in the same way, they give you a steroid drug to keep on suppressing your adrenal gland. And when you kill your adrenal gland, they know they have a customer for a lifetime. So they'll keep on giving you that inhaler. You just go back for another inhaler. And guess who is benefiting? The big pharma. So if you drop the inflammatory foods, the seed oils, the wheat products, the industrial foods and processed foods, the restaurant foods, the sugars in all forms, including fruits and honey, you are at 40% of your recovery from asthma. You try it for about 2 weeks. Zero, zero processed foods, zero seed oils and vegetable oils, zero sugars. And then introduce an intermittent fast. And then eat the healthy foods, the meats, fatty meats for that matter, for vitamin D, because vitamin D deficiency can give you asthma. Eat the eggs plus the yolks. Make them organic eggs. Eat those green leafy vegetables. Eat that fish. Eat that chicken plus the skin. Eat all meats, red and white. Just make them fatty. Change your cooking oil to ghee, coconut oil, tallow, butter. Use olive oil to top dress your salads. Not use it for cooking. Use it to top dress your salads. Then go out and enjoy the sun. Literally every day have a date with the sun. Have good sleep to lower your stress levels, because stress can actually activate asthma or exacerbate asthma. Drop those painkillers that you buy in the pharmacy all the time because you have a pain, you have a headache, you have a joint pain, you have back pains. Just lose the weight, lose the inflammation through what I'm just telling you. Don't go for diclofenac, don't go for aceclofenac. These are drugs that hurt your kidneys. These are drugs that hurt your bronchioles, and they actually open up a channel for formation of leukotrienes that exacerbate or that activate asthma. So drop them. Drop the cough syrups. Use antibiotics only when they are prescribed. Some of you are actually using antibiotics like amoxicillin, kuchana mira, to chew cut. You're abusing antibiotics for that. Drop that. Enjoy salt in plenty. Add a pinch of salt in your drinking water. It will fix your gut, because once you fix your gut, you fix inflammation. And guess what? Asthma disappears miraculously. And that is what we want. Drop milk, pasteurized milk, or any other milk. It's for babies. Let it go. And then if you have nutrient deficiencies like magnesium, like selenium, like sodium, like zinc, like potassium, enjoy foods that are rich in these nutrients. Potassium is rich in green leafy vegetables. Potassium is also rich in egg yolks and the liver. So is magnesium. Magnesium is also rich in sea salt and Himalayan salt. Zinc is rich in avocados and pumpkin seeds. Selenium is rich in nuts. So enjoy your nuts. This is what you just need. You need foods and natural foods. You don't need synthetic foods for that matter. So yeah, that's how you manage asthma, and that's how you reverse it. You don't manage it, you treat it. Asthma is treatable. Which painkiller is better for an asthmatic? Paracetamol. And only a 3-day dose. Pain is not a disease, should not be treated. Pain is a symptom, so focus on what is causing pain. Good. Doc, what about nasal drops and sprays? I was prescribed and they made the condition worse. Now, the reality is, in the markets, there are a lot of counterfeit products. Counterfeit products are those products that actually mimic the real drugs or the real medicines, but they don't have any active ingredients. Nowadays, they even make it in Italy, in Kenya. A lot of counterfeit products in the markets. But nasal drops will also manage the symptoms. So nasal drops, like ephedrine, they're actually going to open up your bronchioles a little bit. That's also managing the symptom. Okay? So treat the cause. Good. So thank you so much again. We started this with boy, milk tea without sugar is weakness. Hey, Sally Gishia, milk is for babies and calves. Let it remain that way. If milk was important, you would be suckling your mother by now. But human beings are the only species that change the species that they get milk from. But they are very specific. So they can take goat milk, they can take a cow's milk, but they cannot take a donkey's milk. So you're actually taking milk that belongs to the calf. So yeah, I think that's it. We call it a night. We'll see you again on Monday as we talk about a condition that will actually communicate to you. But I was hoping that on Monday we can talk about cholesterol. Okay, so if you're ready for cholesterol topic, we can talk about it on Monday, and we get educated. We help people reverse high cholesterol in the system. We help you undo those drugs that are used to manage cholesterol, which is just a fallacy. So yeah, we hope that you join in at 8:30 p.m. on Monday. Have a good weekend, and actually, uh, we have some clearance. Before I do that, let me make an announcement. We have a Telegram channel that is called Health and Wellness Sport. So you can kindly join into that channel, Health and Wellness Sport on Telegram. It has a lot of information for you. You can also follow us on Facebook and Instagram. I exist as Dr. Lewis Muchile. And then you can also follow me at Lewis Muchile on X, formerly known as Twitter. Now, tomorrow, which is on Saturday at 8:30 p.m., we are having an X space. Let me just call it a Twitter space because most of you still think it's called that. So we're having an X space or a Twitter space. We will also have it in conjunction with a space on Telegram. So kindly join in at 8:30 and let's have those conversations. Bring those conversations on board on X and on Telegram. We will highly appreciate your input. We are opening that space for you to share your views on voice, and so that other people can get to learn from you, and as well as you learn from other people. So be there at 8:30 in the evening so that we can push this wheel of healthy living. Above all, if you're a new subscriber here, kindly, or if you're a new fan here, kindly consider subscribing. Press that notification bell so that anytime we have a brilliant health idea, you'll be the first one to be notified. For those of you who have been returned subscribers, we cannot do without you. We say thank you so much for the support. We're almost at 21,000. This is just amazing. So thank you so much for logging in. Until Monday, see you then.